Hi, this is Dr. Sigmund back again at CORE Chiropractic, and we're here again to talk about headaches. And what I get a lot often is asked me if headaches are a normal part of life. Nobody should have to deal with headaches on a daily basis. Having headaches every day is not normal. I mean, there's times that people maybe have issues where they get dehydrated, they're excessively stressed, maybe they get some tension headaches. Maybe they have different side effects, maybe some medications that they're taking, and it can spur on a headache. But to have consistent headaches all the time, day in and day out, is not normal. Okay, even feeling pain is not normal. That usually means that something nerve-related, whether it be usually in the neck for people who have headaches, or in the upper back, some nerve in that nervous system is getting affected, where the bones in the neck are getting pulled out of position, where you can see the spine from behind, where certain parts of the neck are shifting from side to side, maybe they're tilting. For a lot of people that are in the upper neck, they have issues where the first two bones in the neck are in a bad position. They're shifting, causing the base of the skull to maybe shift to one side, can cause different types of pains, can cause equilibrium problems, like we say, like balance, dizziness. But no, having pain is not normal. And just that's what pain is. It really is just where there's some kind of a shift or an imbalance into the spine that's causing pressure onto those nerves that affects where those nerves go. For people in the upper back, it can go to, like people call it, like the shoulders. It gets really bad. It can go even to the front of the chest. People have problems even taking deep breaths. In the neck, pain can travel down to the arms, get numbness, tingling. Really in the mid upper neck areas, certainly causing problem with headaches. And that's really essentially what pain is. It's really where those nerves are getting affected. And that's what we as chiropractors always want to essentially look at and take care of, is because we're protectors of the spine, and underneath that spine, that's where the spinal cord and the nerves are. So that's what we want to make sure are all happy and healthy, and there's nothing into that spine, what we call a subluxation, where that spine shifts in a bad position and it puts pressure on that nerve. So we want to make sure that all those nerves are happy and functioning the way that they're supposed to. And that will not only help out with the pains that people feel, which is essentially the first symptom that you'll get, but it can cause things like headaches and other things to occur. And it's hard to know if you have a subluxation, even if you don't have pain, because really that pain is the last thing that's going to come up. It's that last symptom. Because 93% of the nerves coming from your body, they allow for function. Okay, they move your arms, move your legs, allow the muscles contract. They make sure that your lungs are pumping, your heart's working the way that's supposed to, all the blood flow is going into the right places. But the main thing is it's going to be that last 7% of those nerves are what cause the pain. That's really hard to know is an issue unless you go to see a chiropractor, because most medical doctors, they say that if you have pain, they're going to take an x-ray of you anyways and be like, I don't know. And then they're going to just essentially just throw a bunch of medication at it, because they don't know how to diagnose the headache other than just saying that you have a headache, and then we're going to give you some medication, and then we'll see if it goes away. And that's why we talk about the pain medication isn't an effective cure for getting rid of headaches long term. I mean, you can take different things like Motrin, Advil, Aleve, Tylenol. All these things can be effective in the immediate phase for essentially getting the headache to go down as far as how severe it gets, but it's never going to fully get rid of it, because you're not really even addressing the main root cause, which for a lot of people is an alignment issue that happens in the upper part of the neck, or essentially just from the posture being in a bad position over time. Because really a pain medication just allows you to kind of block that pain signal going to your brain, telling you that something hurts long enough, and then hopefully over time, people are like, yep, hoping I take enough medication where it goes away, or I sleep it off. That's not usually the case, and that's not how it happens. And what we do here at CORE Chiropractic is we do a lot of different treatments and therapies that can be effective in making sure we get the headaches to go away. So when we diagnose that with the consult, the exam, the x-rays, we'll look at the root cause of why the headaches are occurring. And for a lot of people, like we talked about, it does occur in the top part of the neck. Okay, it occurs in the bottom, because what happens when you look at the neck from the side, we should have this nice, like smooth curve like a banana. Most patients we see in our office, they have that classic military text neck, or even sometimes where the head just drifts so far forward, puts a lot of tension on the back side of the neck here, and all those muscles attached to the upper back, they go all onto the base of your skull. So fixing that posture to get that neck back to where it's supposed to go, takes all the stress off those muscles that connect to the base of the skull, and usually helps out with those headaches. And the chiropractic adjustment is the one thing that can alleviate that stress on those nerves the most to make sure those headaches go away. We also offer something called decompression. We notice that a lot of patients, when they have that loss of that natural curve in the spine, that the discs in the neck start to wear down. And so we're allowed the convenience of having that decompression to stretch that spine, to allow more blood flow to go into those disc spaces to give you more cushion. And the more cushion we have for those parts of the spine, which the discs are these pads right here, the more we can get those cushion and get them bigger, there's more space for these nerves come out of that neck. So it essentially gives you more room for air. Those nerves and those blood vessels are free to flow. So then that way the headaches will go away over time, and we can make sure that we keep those away. And so that's what we usually do. We also offer a cervical traction device in order for us to get that better curve in that neck, different stretches, some exercises. We also offer a therapy here that we have called PEMF. That stands for Pulse Electromagnetic Field. And so that therapy sends this deeper signal deep into the body to alleviate a lot of issues with like muscle spasms, tightness, also increases the relaxation, but essentially allows that body's battery to self-charge. So then that way it has a deeper sense of healing. So then that way, as we're going through the treatment, the bodies have a better ability to heal. It's really effective, really therapeutic. People get on that machine and come off, say they feel better, they feel like rejuvenated, and it gives them a longer sense of healing and allows us to keep everything where we're putting it. And so that's how we do it here at CORE Chiropractic. We take care of the root cause, we fix the problem, we fix the subluxation, the nerves that cause the pain, cause the headaches, reduce the chance of you get on medication, having rebound headaches or headaches from not taking medication, because that's really no way to live. So come over to CORE Chiropractic, get checked out, or if you know somebody else that might need to get checked out, help out those headaches, I'm more than happy to help them all. And we look forward to seeing you all here soon in the office. Y'all have a great day.